I can't remember ever wanting to be anything else other than a nurse. The role just appealed to me. I guess I'm curious about people. Everyone that you're seeing has got their own life story, their own issues that are going on regardless of any health problems, and it's more that life story, I guess, that keeps me hooked on nursing rather than the medical and the anatomy and physiology of it all. It's the psychology of nursing that I really enjoy. In some instances, it's like being a private investigator. Somebody comes to the surgery, you want to find out what their health issues are, but there's always a lot of other underlying things, and it's joining the dots. And it's the more you ask questions, the more you dig deep into what's happening for that individual in front of you. Practice nursing, you're a generalist in that you might see babies for vaccinations, you might see children for asthma checks, all the way through to, routine screening of healthy adults, cervical screening, blood pressure checks, health promotion, and then managing chronic diseases. And I think my role has grown more in that area in terms of looking after patients that have got respiratory problems, especially COPD, asthma, also diabetes, heart disease. And a lot of these patients now, if they're fairly well, would simply see their practice nurse for all their routine care. I have days and weeks where I come in, I see patients, I change treatment, I follow them up, and I don't discuss anything with a GP. And equally, you become a specialist in your own role. You might get the opportunity to specialise in respiratory or diabetes, and you learn in a lot more depth about that disease. And often the GPs will refer to the practice nurses because they're now the specialist in that disease area. I think having been a newly qualified nurse for 7 or 8 years on an acute medical ward that was very busy, initially I was a bit, will it be very slow in practice nursing? Will it be as emotionally sort of satisfying? But I think it is more so in a way, because you build proper deep relationships with patients. You're in a team that largely doesn't change in general practice. You're working with GPs, your nurse colleagues, the reception staff, the social staff that might come in. And I think you can really grow as a family and mould the care that you give. And I think practice nursing is growing more into, I guess, a more holistic art. I think all of us are a lot more aware that it's joined up. There is no health without the social care backup, family, community. I would say it's all as important as checking somebody's blood pressure. People might come and see a GP or a practice nurse for half an hour every 6 to 12 months. Every other day of the year, they're looking after themselves, they're dealing with that illness themselves. So I think it's all about empowering people to know who to contact, know what to do, and it's trying to navigate the healthcare system, which is quite complicated for a lot of people. And I think general practice, we're the gatekeepers of that in many respects.